clear and you're running clear. You're running good. You have to make sure that with a suprapubic tube in place, it gets changed every 4 weeks no matter what. Some people let it go 4 to 6 weeks, but 4 weeks is how long it should go. You got vitals on them?
I'm grabbing them.
Yeah. I took a urine specimen. It looks really dirty to me. So I gave him an antibiotic. We're going to give him an antibiotic, levothyroxine right now. No allergies to any medicines?
No.
Okay. The only real contraindications to giving that is if you're allergic to it or if you're on other heart medicines. No heart medicines, right?
No.
Okay. So from having a catheter change, anytime you can change it, you can introduce infection. Obviously, I had to change it. I didn't have a choice. So I just would worry about the infection getting worse. So I'm going to give him the pill now, and I'm going to write a prescription for 7 days worth of it. 7 or 10 days of it, which means he should take it every day.
Okay, so I got a bunch of questions. So how do you change, first of all, how do you change that tube?
Doctor's office, once a month.
Once a month he's got to go,
for the rest of his life.
He's got to go and get that tube changed.
Or you could have a visiting nurse come and do it once a month. Or if you have someone who's with him all the time, you guys can learn how to do it. Change it once a month.
Why was it clogged?
Anytime you have a catheter in the body, it runs the risk of getting clogged. My patients who have suprapubic tubes, I have them irrigate it once a day. And when you irrigate it once a day, you basically clean out the debris. The bladder, it sheds mucus, it can make stones, debris, lots of stuff lives in the bladder, and it gets stuck in the catheter. The catheter has holes in it, and the holes inside allow the urine to come through. And if debris gets stuck in those holes, just like crud sticking in the drain of a sink, eventually over time it just stops and that's it, no more. That's why you change it every 4 weeks. People who we have a lot of frequent flyers who their catheters clog once a week, so they have people that come in and change them for them once a week.
Wow.
So this is going to be how he's going to be the rest of his life. The best thing you can do is change it every 4 weeks, and if irrigating it every day is too much, as often as you can do it is fine. Once a day, once a week.
So how do you irrigate it?
You basically take a syringe, like I did, you fill it up with sterile water, push the water in, pull it out, that's it. 10 seconds.
Every day?
I tell my patients to do it every day. Sometimes every day, every other day, once a week.
And then, okay, so there's no way to get that tube to go through his penis so he doesn't have to have a bag or anything? It's
better to have it through here because a tube through the penis for a long period of time leads to erosion of the penis.
All right, so there's no easy answer here, huh?
Yeah.
Because he's constantly getting urinary tract infections.
That's because there's a tube in his bladder. So let's sit down and talk about this. I mean, we can look at this visit as, the last thing, I can give you all the information that you want,
no, I understand.
But not his normal urologist.
Yeah, no, I know.
The last thing I want to do is, if my patients ever have an emergency and they go to another doctor, it's just the last thing you want to do is steal someone's patient away and tell them to do, or tell you, well, what your urologist is doing is not right, and you should do what I tell you to do. But I'll be more than happy to give you all the information so at least you know. No,
we came here to see a neurologist, and we waited 6 weeks to get the appointment, and we were upstairs, and all of a sudden he started freaking out that he was in a ton of pain and he couldn't go to the bathroom. So we're going to go to the ER, and then they're like, well, the urology department's on the 6th floor. So we just came down here, so this whole thing just kind of freaky.
Right. So when someone has prostate cancer and has a seed implant, the prostate sort of, in the worst case scenario, clamps down and you can't pee. So that's I don't know exactly what happened, but most likely his prostate obstructed, he couldn't pee, and the only way to get him to pee was either to put a catheter in his penis or put a catheter in a suprapubic tube. If you put a catheter in the penis, you run the risk of the head of the penis eroding away over time, and it basically rots the penis away. Not a good option.
Wow.
And it's also a tube in the penis. It's not comfortable. Second best option is the suprapubic tube, which is great because there's nothing in the penis. It frees, the penis from eroding, and the skin around the stomach is it heals a lot better. Okay. Other options. Most likely he'll never urinate out of his penis again on his own, so that's off the table. Other options are creating a new bladder to where it just leaks out of the side of his stomach, but he'll never urinate the same again. So this is a great option. You just have to be aware that there is a foreign body in the bladder at all times. You have to manage that appropriately. Irrigating it keeps it clean, decreases the amount of urinary tract infections. The more often you change it, decreases the amount of urinary tract infections. And I noticed that when you guys came in, there was like a Band-Aid on top of it. When you put like a clear plastic Band-Aid on top of it, it traps all of the it traps everything in there, and it's like a breeding site for bacteria. The best thing you can put on is just gauze and paper tape, or nothing at all, because you want that area to be able to breathe.
So should there be like Neosporin in that area all the time?
Well, right now I would be putting Neosporin on it twice a day because it looks a little inflamed. But the worst thing you can do is put like a non-breathable patch on top. Just gauze and paper tape.
Yeah.
But the truth is, most of my patients who have these don't put anything around it. Just leave it, let it go.
They just leave it as is.
Yeah, because the skin will heal well on its own.
So do you recommend just leaving it alone?
Well, now I don't, because now if you look at it, it's a little red. Sorry, I don't mean to hurt you.
So I should shave it? You don't have to show me.
No.
Well, so I should shave the area.
No, you don't have to shave it, but see how it's a little red around there right now?
Yeah.
Yeah, you just want, if you put Neosporin on that twice a day, that redness will go away. And once that redness goes away, you can continue to put dressings on it, which is fine, or just let it be. Okay? But normally what I would say, people who have indwelling catheters, whether it's through this way or the penis, expect to get 4 or 5 urinary tract infections a year. That's normal.
He doesn't drink enough. That's the biggest problem.
Yeah, well, you guys got to make him drink.
He's always dehydrated.
You got to make him drink.
So why is his urine like red?
Because his there's 2 reasons why what happened today happened. Either he was getting a urinary tract infection, which, well, you can leave if you want. You're just standing here. It's okay. I know you have other things to be doing.
Sorry, that's not real.
Either he was getting a urinary tract infection and all the bacteria just sort of clogged up the catheter, and that's what caused everything to happen, or he could have a bunch of little stones in there that are clogging it. I can't tell if he has stones because I haven't looked at his bladder. When was that suprapubic tube placed?
About 2.5 years ago, I think.
Okay.
Maybe 3 years ago.
Okay. Let's get him to sit up. And why don't you guys have him get dressed, and I'll meet you guys in another room.
Okay. Wow, I can't tell you how much I appreciate you just seeing him.
I'm going to send his urine for a urinalysis, urine culture, and but I'm going to give him antibiotics anyway. But I need you to call me. Today's Wednesday. I need you to call me by Monday to get the results, because if the bacteria that's in here doesn't work with antibiotics I'm giving him, I'm going to have to give you guys new antibiotics.
How are we going to know if it's working?
Because this will come back sensitive to what I'm giving him, which means it'll work.
Okay.
Okay. Is he always just flushed? Is that what he normally looks like? Or does he look a little flushed?
He's stressed out right now.
He's stressed out right now?
And he was in a lot of pain.
But you're feeling better now, right?
Yeah.
Yeah. No more pain in your stomach? Okay.
Dad, say thank you.
Are you taking a picture of him?
Well, there's a lot of people that want to hear about everything that's going on, like in the family.
Mm-hmm.
So I try to, every time I talk to a doctor, I try to just record the audio so they can listen to it. He was in a lot of, I was getting scared because I'd never experienced that kind of problem.
He was clogged, so he was in retention. And as soon as I took out the catheter, it gushed straight out.
Yeah.
So I want to talk to you guys a little bit more just so that I can give you guys all the information you can get for today. But the most important thing about today is the catheter's clear. I'll give you prescriptions for supplies to keep it clear.
Okay.
And you saw how I did it, right? Did you see how I did it? I filled up the syringe, I injected the water. You only need to do like about 60 cc's. I'll write it all down for you.
So that'll...
And the paper tape too.
Yeah, I can give you all that.
So that'll really help him not get so many infections with the flush?
The flush helps keep the catheter clear. By keeping the catheter clear, you're less likely to get an infection.
All right.
When was the last time you had an infection?
A month ago.
Yeah. Whoa.
So once a month we've got to come here and see you.
Either see us or your regular urologist.
Well, he just moved from New Jersey, so he needs a new urologist.
Where do you guys live?
In Yonkers.
Okay, yeah, so you come, we'll be your urologist from now on, and you come and see, we'll take care of you once a month. Is that okay to bring him in once a month?
Yeah, I mean...
Who manages his
his neurologist is upstairs, so...
Perfect.
Try to just set up the appointment together.
Yep, same day. What days is his neurologist in? Is it Wednesdays?
That is our first appointment, so, yeah, I guess today's Wednesday, so I guess he's in Wednesdays.
All right, so we'll do Wednesdays. Dr. Polizzi is the physician that I work with, so he'll be taking care of him, cancer-wise.
He just has Parkinson's, that's his only issue.
No prostate, you said, but the prostate cancer he had Sept.
Oh, that was 10 years ago.
I know, but his PSA's been good, no rise in that? He's been monitoring his PSA.
I guess he's got to get checked for that now.
No, you don't have to sit, because we're going to go out. We won't do that today. We'll do that at your next visit. So I'm going to get another blood test today.
Okay. All right. Wow. Thanks a lot.
Come on in. Follow me.